44. Anterior displacement of condyle is due to option A lateral pterygoid, option B buccinator, option C medial pterygoid, option D temporalis. Answer is option A. That is lateral pterygoid. The lateral pterygoid muscle has two origins. One head originates on the outer surface of the lateral pterygoid plate, and an upper or superior head originates on the greater sphenoid wing. The insertion is on the anterior surface of the neck of the condyle. In addition, an insertion is evident of some fibers to the capsule of the joint and anterior aspect of articular disc. The superior head is active during such closing movements as chewing and clenching of teeth, and during swallowing. Presumably, the superior head positions or stabilizes the condylar head and disc against the articular eminence during mandibular closing. The inferior head assists in the translation of the condyle downward. The inferior head assists in the translation of the condyle downward anteriorly and contralaterally during jaw opening. The reference is from the Wheeler's Dental Anatomy, Physiology and Occlusion, 9th edition, page number 266. Question number 45. Muscle attached with articular disc and have role in displacement in condylar fracture. Option A lateral pterygoid, option B medial pterygoid, option C buccinator, option D temporalis. The answer is option A lateral pterygoid. Question number 46. The PHP index described. Option A performance of hygiene by patient after brushing, self-evaluation. Option B measure oral hygiene and gingival bleeding. Option C scores the plaque and gingivitis. Option D evaluate plaque and calculus on specific tooth. Answer is option A. The PHP index describes the performance of hygiene by patient after brushing, self-evaluation. The patient hygiene performance index, PHP index. This index for assessing an individual's oral hygiene performance was introduced by Pod Shadley, A.G. and Halley, J.V. in 1968. The reference for this is from Essentials of Preventive and Community Dentistry, Schoben Peter, 4th edition, page number 357. Question number 47. Which of the following is example of disability limitation? Option A reducing occurring of polio by immunization. Option B arranging for schooling of child suffering from PRPP. Option C resting affected limb in neutral position. Option D providing caliper for walking. Answer is option C resting affected limb in neutral position. Resting affected limb in neutral position. It is called an example of disability limitation. When a patient reports late in the pathogenesis phase, the model of intervention is disability limitation. The objective of this intervention is to prevent or halt the transition of the disease process from the impairment to handicap disability. Because of an impairment, the affected person may be unable to carry out certain activities considered normal for his age, sex, etc. This inability to carry out certain activities is termed disability. This inability to carry out certain activities is termed disability. A disability has been defined as any restriction or lack of ability to perform an activity in the manner or within the range considered normal for a human being is considered disability. The reference for this is from Park's Textbook of Preventive and Social Medicine, 23rd edition, page number 44. Question number 48. Paresthesia in inferior alveolar nerve blocks mainly due to option A, lower acidic pH, option B, injury to medial pterygoid, option C, contact of needle with the main trunk, option D, injury to lateral pterygoid. Answer is option C, the contact of needle with the main trunk. You get the paresthesia in the inferior alveolar blocks. Okay, the paresthesia in the inferior alveolar blocks is mainly due to contact of needle with the main trunk. The paresthesia is defined as persistent anesthesia. Persistent anesthesia. Anesthesia will beyond the expected duration. That is, anesthesia will beyond the expected duration or altered sensation, or there will be altered sensation well beyond the expected duration of anesthesia. Trauma to the nerve sheath can be produced by the needle during injection. Many patients report the sensation of an electric shock throughout the distribution of the involved nerve. Although it is exceedingly difficult and is highly unlikely, although it is exceedingly difficult to actually sever a nerve trunk or even its fibers with small needles used in dentistry. Although it is exceedingly difficult to actually sever a nerve trunk or even its fibers with the small needles used in dentistry, trauma to a nerve produced by contact with the needle is all that may needed to produce paresthesia. Trauma to a nerve produced by contact with the needle is all that may be needed to produce paresthesia. The reference is from Handbook of Local Anesthesia, author Stanley F. Malamud, 6th edition, page number 294. Question number 49. Hematoma formation during or immediate following a PSA block is most likely to be a damage of option A, injection in pterygoid plexus, option B, injection in facial artery, option C, injection in internal maxillary artery, option D, injection in small capillary and arterioles. Answer is Option A. Injection in pterygoid plexus. The complication of the PSA nerve block, hematoma. This is commonly produced by inserting the needle too far posteriorly into the pterygoid plexus of veins. Hematoma in PSA nerve block. This is commonly produced by inserting the needle too far posteriorly into the pterygoid plexus of veins. In addition, the maxillary artery may be perforated. Use of a small needle minimizes the risk of pterygoid plexus puncture. The reference from Handbook of Local Anesthesia, Stanley F. Malamud, 6th edition, page number 195.